I originally was being seen by the VA, and it basically just got to the point where I couldn't keep going to them for like psychiatric services, and yeah, so 2021.
Yeah.
So it's always super hard to find anybody to see anybody, especially when you're coming out of like the VA to private practice. And I used one of the apps. I can't remember which one it was.
I think you use the
ZocDoc, something
Yeah,
like that. Yeah,
yeah.
so basically
online, basically.
Yeah, and
and
my biggest thing is I wanted to see somebody who would see me in person,
right.
just because I didn't, especially coming in when you're dealing with like certain medications or certain mental health stuff, like it's very easy to find like a bad doctor, and it's just like gonna throw you prescriptions over the internet. So even though you're like 4 hours from Pittsburgh, was the fact that you were like, no, I want you to come see me first. And then also the fact that when I got here, it wasn't just, usually when you are seen for stuff like PTSD or anxiety, they're like, that's all you have to deal with, and then everything else is a result of having, these mental issues. And I don't know, for me at least, being able to come in and, talk to you about like my diet, give resources on like, how you take care of your body so that you can take care of your brain. Like I never really got
360 wellness.
Yeah. And I think also too, like, the fact that I came in and I was like, I don't want to take more drugs. I don't want to take different drugs. I don't want, and the medication I'm on, I'd like to, manage coming down off of it. Like, that's a hard thing to find in a lot of doctors.
So, we actually told, I think I remember very well our first conversation. I was still painting the whole
thing.
I said, look, Chris, I want to microdose you. I actually want you at some point get off of the medication.
Right.
We're gonna like risk assess you and manage it. How can we give you the most benefit out of the medication you need with least side effects?
Right.
That was, you were on with it. So.
Right. No, and I think also like, the fact that I could, I don't know, just be able to ask kind of like bigger questions and not just sort of get like, I'm only going to see you through this lens. That's been really helpful.
That's it, and that's been our vision, is to do 360 health.
Right.
Because our brain, our psychological health is far more than just one little aspect of what we do. I mean, our brain health is affected by how we nourish our body. It's affected by our exercise and fitness levels. It's influenced by our social relationships, And so, our whole goal of setting up Lancaster Wellness, we talk a lot about weight loss. Most of our videos are about weight loss, but we do also do holistic medicine,
wellness.
Yeah, that focuses on sleep, nutrition, social relationships, harmful substances, all those things.
I think, I also know that, like, everything you just mentioned, like, usually when I go to the doctor's office, it's like a very anxious experience for me, and one, I'm just used to like going to the VA hospital where you're like, that guy doesn't have any legs. I'm sad sometimes, can I really, like, what am I doing here kind of thing. And just kind of like, I don't know, coming, and especially being able to talk to you guys like through Spruce and stuff like that. I don't know, I'm not like distrustful of like medicine type, but I especially now where like internal medicine and it's like just all these different services, it's such high demand, like there's such a high patient load in those places. Like
that's it.
I think if I can come in and say like, hey, I don't know if the medication's working, and I don't have to worry that you're gonna like, okay, 15 seconds later, here's what you're getting by. Like, I as a doctor don't have enough time to talk to you, kind of thing.
We keep the limit of 8 patients per day. So
right.
We spend literally an hour. If you want to come chat with me about it, we have time for that.
No, I mean, like I said, I drive for 3.5 hours each way, and like I don't. To me, it's I don't know, it's been worth it. I feel like there's.
I think you were here at least an hour so far, right? Talking.
Like
today's.
Right, and I mean, it's I've never been able to go to a doctor and then have somebody, it's like I was just telling Don, and like I feel dumb for not thinking about some of the simple stuff that we talked about on like diet side, but that's part of it is because I wouldn't expect to be able to go into any doctor's office and get it. I mean, this is the first private practice experience I've ever had in my life. So, and like to be honest with you, like it is private practice. I'm paying out of pocket for it, and it has. I can tell that like because the anxiety of like where I'm gonna get seen isn't there. Like it's been you know, I haven't been like, man, I'm paying a shit ton of money for this, and I'm not getting what I want out of it. Like it's in terms of my medical, you know, experience, it's been like the best ROI.
Do you feel like the value is there?
Yeah, I mean, I you know, it's the fact that I know, you know, if I've got questions about diet stuff, like when we were discussing Mediterranean diet, I'm like, hey, doctor, I don't want to waste your time.
Right.
I mean, like, what do you know, think about diet? And the fact that I can talk to Donovan about
And it's not only wasting my time. Donovan is really good at it because he spends more and more time with it. He actually knows more about it than I do, and I'm not ashamed to tell you that because I don't do that for a living. That's why he's hired.
Yeah, I feel like usually when you go to a doctor's office, you're like, well, here's the nurse who's going to take your vitals, and then whatever questions you have like a 10-minute window to through the doctor.
Ask them quick.
Right. And so, you know, not having that kind of pressure has been.
It is important to have that balance of like, hey, it's not just chemicals we're giving you, we're also telling you about stress management, lifestyle.
Right. And I think that, you know, as somebody who's been very conscious of like, you know, because I am on a medication that like plays a big role in my life, but I have always kind of felt like when I'm talking to doctors, when I'm getting it prescribed, they're like your ability to function is because of this medication, so don't ever leave the medication. You know, being able to talk and be like, you know, I don't know, like thinking about diet as a form of like stress management is not something I you know, doctors have said, oh, you should eat better. All right, sweet thanks. You know,
what's that mean? Yeah,
exactly. Yeah. So yeah, no, I've been, you know, it's. I was telling you, like I have friends, you know, other friends who go through the VA healthcare system and have a lot of frustrations, and I was just like, you know, straight up, like I'd recommend it. Unfortunately, they're out of state.
Yeah,
but you know,
we talked about it.
Yeah, I think that like this is the kind of thing that, you know, I if you told me that I'd be 31 and be able to afford out of pocket, you know, my own private practice, like being able to go be seen in a private practice, I wouldn't believe you. And no, like I said, it's. I'm still waiting for the other shoe to drop. Like you guys should be like, actually, we can, you know.
I'm not a real doctor.
Yeah. It all goes up, and I'm all like, pumped or something. We didn't even see those. This is all a joke. But no, for I don't know. It's it's been good, and I think, you know, also like because when I first came here, I was having issues where, you know, another physician was changing my medication. Was making all these decisions for me. I wasn't. You know, when I was like, basically they were just doing stuff that didn't have anything to do with, you know, what was actually happening to me. And I was very like skittish about being seen by anyone. So I, you know, for what it's worth, I think like if I was willing to show up, come in the door, like that took a lot. So you know, it felt very accessible and like inviting, if that makes sense.
Yeah, absolutely. And I remember you talking to me about like your experience in VA, and obviously they have a high volume, they do a great job, but I think because of the high volume, they may not be able to provide that individualized care. And medicine is very individualized. It's not, you know, it's not a conveyor belt. You're not making Fords here.
Right. Well, you know, I think that like just straight up like the region we're in, right? You know, especially on the western side of the VA, like because of the opioid crisis, you know, the sort of doctors are not looking for. They don't want to take more people on because the patient load. And if you come to them with the medication ahead of time, they're already looking at you like, okay, you know, and I remember the fact that like when I first came in, I was like, look, this is where I'm at, this is what I've been on, this is the changes. I remember being very afraid that, you know, you were going to be like, oh nope, like you're too much liability. And so the fact that you're willing to like talk to me about it and also say like, hey, look, like I'm going to know if you're bullshitting. And I will stop seeing you. Like I actually did. I remember appreciating that because it kind of made me trust that. You know, okay, this guy's not. This isn't a. You know, not that this would be like a pill mill, but you know, it's conscious of like there's, you know, the balance of like agency that I have as a patient, but also responsibility. To see my end through. Like I think that's been really useful for me.
Absolutely. I knew that medications you were on and the job that you're required to perform was affecting your quality of life. And I would never say no to anyone who needs it. I would evaluate you. I think we did 3-4 evaluations before we started or anything.
I mean, it was like a month and a half too. And honestly, it was healthy for me because, they put me on a different medication, and in hindsight, rather than just being like, okay, jump off of that, back to the other one, you know, I had this like month and a half where, you know, I kind of had to like